Years after the Yobe state government started offering free dialysis to patients of kidney diseases, its university teaching hospital is set to begin kidney transplants in partnership with Mansoura consulting firm in Egypt. Now let's get more on this and plans by the state on patient care. Joining us is the Commissioner of Health in Yobe State, Dr. Lawan Agana. A pleasure having you with us on the program.
Thank you for having me. I'm glad to be with you.
Great to have you. Now, there's worry over the rising cases of kidney diseases in Yobe State, and 5 local government areas have been singled out. What are the factors, perhaps, relating to the lifestyle that have been identified to be responsible?
Actually, what we have noticed was high rates of kidney disease along the northern part of the state, Gashua, Nguru, Yusufari, and others. But then, of course, we also have communities that are bordering the river basin. It also even spans to local governments in Jigawa State. Although we're still working on commissioning a research in partnership with a UK-based organization, the BioRTC, where we are looking for grants in order to carry out the research on establishing the root cause, specific root cause. But then some preliminary studies have shown that there are issues with some environmental chemicals in the soil, and then of course problems along the utilization of agricultural chemicals and so on and so forth. There are some heavy metals that was discovered that seemed to be on the high side, but then the study to link that to human subject has actually not been conducted, and this is what we are in the next few months we are hoping to start.
Okay, so the FMC Nguru Medical Director disclosed in a report that the medical facility has only 4 dialysis machines to cater for the growing number of patients in the area. Am I correct?
The state government actually has 2 tertiary institutions that are capacitated to deliver nephrodialysis services. Yes, the Federal Medical Center in Guru is one, but then the Yobe State University Teaching Hospital also has those machines. In the University Teaching Hospital, as it is right now, we have 7 machines. And of recent, through the Federal Ministry for Water Resources that was facilitated by our member representing the Gujiba Gulani Damaturu Tarmoa constituency as part of our constitutive project, for facilitated the establishment of another dialysis center. And in that, in addition to the other equipment, 3 dialysis machines were also donated to the state. So as it is, we have 10 then in the teaching hospital, and then of course another the 4 that the medical director in FMC Guru has stated.
So that's 14.
Yes.
Okay, but this 14, isn't it like a drop in the ocean compared to the magnitude of problem you are dealing with, especially people needing dialysis?
Yes, this is still work in progress. As we know, the government of the state under His Excellency Honorable Balaboni has also continuously seen how to continue to improve in ensuring that the necessary medical equipment are made available. As it is, is actually free, given free of charge to the population. This is in addition to the highly subsidized dialysis drugs that are also given to the patients. But in addition to that, with the establishment of the new center, we're also looking at, we're having discussions on adding additional dialysis machines. The approach what they were taking is basically to look at how to prevent the occurrence of the disease by establishing the root cause of the disease. But then those that have contracted the disease also to give them respite, because we know that dialysis is actually a very expensive intervention. So as it is, the state government, like I said, provides those services free of charge. And even for non-indigenous, when you look at it, the charges are actually highly subsidized. They are far less than what the other facilities provide in other states. And like we said, we're also continuing to see how we can improve on the quantities of the machines.
Okay, the Commissioner of Health in Yobe State, Dr. Lawan Ghana, thank you so much for talking to us on the program.
Thank you so much.